Okay, here are the brain-based therapy exercises that we're going to be starting with. The first one we call is ×1 or X1. This is for the cerebellum, which has to do with balance, posture, fine hand-eye coordination, almost all of those things we tested on your initial exam. What you do is I recommend grabbing your toothbrush, and for this video, here's the toothbrush. The reason for the toothbrush is every single time you brush your teeth, grab that toothbrush with the side of your cerebellum. Most of you will be left-sided, some of you will be right-sided. Whatever it is, hold the toothbrush in your cerebellum side. Which side is that? That's the side we have your eye lights on and all the stuff we're doing things with. That's going to be your left or your right. For me, it's left. I hold my toothbrush up here for ×1, it's called. I'm looking right here. My head is going to turn left. I'm keeping my eyes on the toothbrush bristles, and then it turns right. We're going to do this until we either feel yucky or 20 times. This is 3, 4, 5, 6, 7, 8. The toothbrush is not held off to the side like this at my shoulder. It's in the center of my body, just like that. Okay. The next one we're going to do is called ×2. This should come after I've cleared you to do it, or you feel so comfortable with this that is so easy you don't even have to think about it. We have to get that down first. ×2 or X2 is the next added one. Same thing. Toothbrush on the same hand. We're going to move our toothbrush to the right. Head goes to the left. It's a complex movement. This goes to the right, this goes to the left. The eyes are staying on the toothbrush. Here, 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 here. This can be done seated, okay? If you get really good at it, you can actually do it standing. Notice my eyes are staying on the bristles, okay? That's what we want to do. Okay, so that's ×1 and that's ×2. As we get going, some other therapies that we're going to want to do is called the dot wall. Are you able to increase the size of that so you can see me over here? The dot wall is right here. On the dot wall, we're going to turn a metronome on the computer. It's called metronomeonline.com. And in just a second, Alex will turn the metronome on for me. We're going to go with our same side. If you're left-sided like me, it's always left hand. If you're right-sided, it's right hand. It's going to be the finger-to-wall test. You're going to put dots or something like this sparsed out all over the wall. Set your metronome on to about 60. Okay, 60 beats a minute. With the beat, we're going to go here to nose, number 1. Nose, let's see if I can get it. Nose, 1. Nose, 2. Nose, 3. Nose, 4. Do it to the sound of the metronome. And then start over and go 1 through 8. We'll put 8 dots on there, and we're going to want to keep going all the way around until we get to 8. Do that 3 or 4 times, and if you get really good at it, more is better, more extra credit. Okay? The next thing we want to do, and don't do all of these at once. We'll blow you right out of the water, so we're just going to start. Each one of these can be added 1 week, and then the next week, and then the next week. Check in with me if you have questions. The next thing we want to do is grab a chair. Any old chair will work that can spin. This is called spin therapy. On spin therapy, what we want to do is really simple. You spin, okay? If you have a left side cerebellum, that's the side that we're working on, you spin to the left, okay? So what we'll do is with the chair, for this purpose, I'll use my office chair. We will sit like this. Since I'm a left-sided cerebellum, I will spin at about this speed. It should take me about 4 seconds per revolution. This might be week 3. Week 3, if you're doing good with your brain-based therapies, and we're building it up. We can't pass ×1 until we're done. As soon as you're good with that, then you're going to do ×2. Okay? These therapies should take you no more than about 2 minutes each time you do it, hopefully twice per day. When we're good with this one, then the next one we can do is a spin sitting with your left hand if you're me, or right hand if you're a right-sided cerebellum, up like this, focusing on your thumbnail. Again, not all at the same time. Maybe in week 4 or week 5 you can do this. Hold your thumb out, look at your thumb, and spin. This makes it a lot more difficult. Makes it a lot more difficult for the cerebellum to be able to handle that. This is called spin therapy. with fixation. So spin therapy with fixation. That's going to be a really great start. We have so many more brain-based therapies for you to do. Remember, with this program, we want to not only create reinvent your life, we want to get you that return on investment of at least 10 to 1. I need your help to do that, to rebuild this brain of yours. And lastly, we want to get you that exit strategy, which means I don't want you to depend on this brain-based therapy program, on your doctors, on their medications, including my program. I want to empower you and give you the tools necessary to fix up your own brain so that we can move you on into your life. Thanks for your time. Call me, or email if you have any questions, or just ask us when you're in the office. Have a great day.